Greetings. I've published this screen right here as a graphic quite a few times, and I decided to make a short video on the topic. So Americans remember in 2001, September 11th, 2,996 Americans were killed by Islamic extremists. And I remember that well because I was working in New York at the time. And I was maybe detached a little bit for the first couple of days until I found out that there were a couple of people like me, out-of-town consultants, who were missing. So I visited a lot of the hospitals that you see on the news now, several of them. Of course, they were never found. Then, this is something that really pissed off Americans. And, this CDC, I don't know how Americans feel about this pandemic that's taken over the country. Are you pissed off or just worried? You should be worried and pissed off. You should be pissed off at China because it's China's virus, but you should also be pissed off at the CDC. So China, it's going to come out probably that the virus, everybody knows it didn't come from the seafood market, and there's proof. I don't know what we're waiting for, but it came from a laboratory. And, there's proof that it came from a laboratory. And I'm going to address some people who, fight that thought in another video. There's a university professor from New York who came out and said there's scientific proof that it's not from the laboratory. Well, I'm not a scientist, but I have a couple graduate degrees and I have a few decades of consulting, and I beg to differ with you, idiot, because that's what you have in that article is not proof. It doesn't even resemble proof. Anyways, I'll get to that later. So right now we're looking at 23,622 dead Americans because of this virus, and we're looking at over 500,000 infected Americans, and we're not over yet. Those numbers are probably going to double. And this is China's fault, but, we have the CDC, the Center for Disease Control and Prevention. What do you guys do besides showboat? You get on the news anytime you can and self-promote, and you take off to China thinking you're going to save the world by going to China. Who cares if you're in China? Nobody cares about anything that you guys do because, you screwed up the biggest thing that you're responsible for, and that's protecting Americans from disease. And, the disease is COVID-19, comes from a virus. Where were you guys? Okay, I have a couple of graphs and a couple of charts on this page, and on the left side it's SARS, and on the right it's MERS. Now, the reason I put these in here, these are both viral pandemics, and they're both coronavirus, and that's why they're included here. And I didn't put anything in here about AIDS that came out of Africa, or Ebola that came out of Africa. Most viral, I guess you can call Africa another hotbed of viruses and other infectious diseases, but China is the number one place in the world where these viral pandemics happen. And in China, on the chart on the left, you can see China 5,300 cases, Hong Kong 1,700, Taiwan 346, Canada got in there somehow, and Singapore, Vietnam. Most of these are right around China, and in Southeast Asia, and it went as far south as Singapore. And MERS on the right, mostly all Middle Eastern countries, and somehow South Korea got in there as the number 2 country. But as far as the United States goes, we had 27 cases of SARS and we had 2 cases of MERS. And did you know that? No, probably not. Nobody died in the United States from either one. So, it barely made the news unless you pay attention to the international news. So I guess you could say that the CDC was prepared for something like this. They were prepared for 27 cases, and they were prepared for 2 cases. And, I guess they think they should get a badge for this or something. That's their job, is to be prepared. They're the Center for Disease Control. So maybe they had enough test kits, for SARS and for MERS. You didn't hear about test kits back then. Why? Because we're not in the same situation that we are today, where we have, zillions of infections and not enough test kits. So, maybe the CDC was prepared for something like this, but they weren't prepared for a pandemic. I mean, if you look at these charts, you're looking at pandemics. They happen. They happen in China. They happen in the Middle East. They happen in Africa. Did the CDC think they can't happen in the United States? Yeah, apparently, because they smoke crack all day. They literally do. They don't do any, their job is to protect us, to protect this country, from a pandemic. And they failed. There was never a CDC plan for a pandemic. Now, this is the dashboard that the entire world follows. I put out some videos before where I was, analyzing what's happening in other countries like, Germany and Italy. And, every time you see another country, their health people getting together and having a big meeting, this is on this graphic right here, this Johns Hopkins piece of work is in the background on a big screen or something. So this is the Center for Systems Science and Engineering, which is a research institute at Johns Hopkins University. And I worked at Johns Hopkins, but I didn't work at this particular research institute. So, but I know what they do, and they put this together, and this is like the de facto, information dashboard, for the coronavirus. Everybody uses this. So this is the current situation here. We have almost 600,000 confirmed cases in the United States, 23,600 deaths in the United States. And we are in this condition right now because the CDC was not prepared. They didn't have any kind of a plan for a pandemic. Apparently they planned, for 27 cases and 2 cases, not 600,000. So that's why we're in the condition that we're in today, because of China mostly, and because the CDC didn't respond to that, to a threat from China. So there was never a CDC plan at all for a pandemic. And, it's hard to imagine why. They're ready for 27 cases, but they're not ready for thousands. Nobody cares about 27 cases. Nobody cares about 2 cases of MERS. Nobody cares. Nobody knows what those numbers are. Nobody died. No Americans know that it infected the United States at all. So what would an adequate plan be? Adequate joint plan with I put a bunch of different entities in here, like the Department of State. The Department of State ought to be able to protect the United States in the event that the president says we're going to ban all incoming flights from China, or from first from Hubei province and then from China. So you depend on the Department of State to do that. Don't let them get on airplanes that are heading for the United States. If you have an airplane in flight, let it land in New York City to refuel and then get it the hell out of the country. Turn it around and send it back. Nobody gets off the plane. Department of Homeland Security. Once you get into the United States, the Department of Homeland Security should be in charge of a few things. TSA, Transportation Safety Administration, would help out at airports. I put ICE in here because ICE works with local and state and federal law enforcement a lot. ICE is, Immigration and Customs Enforcement. They're the people in the DHS that carry guns and can make arrests. And then National Guard, basically for volume. You saw China send in the army, to work in Wuhan, and that's one of the areas where China screwed up. They sent them in there with personal protection equipment, but didn't give them any instructions on how to put it on. And, they got 1,700 of them got infected in the first couple of weeks. And then a couple thousand, a week later local or state police departments, you have to work with them because there's areas of the country where you don't have any DHS people or TSA people. You could have Chinese people landing in Canada. It's easier to get in Canada than the United States. Canada is just more open country. And, then you can get into the United States just by driving across the border. So, you've got to have, all this stuff planned. Chinese people can be sneaky. I mean, this was the Chinese New Year, the biggest holiday of the year. And it's kind of like our Thanksgiving. I've lived in China, and I've been there over Chinese New Year, but I never, went back home to the villages where I came from because I'm American. But, a lot of people go back home to their little villages. They'll leave big cities like, Wuhan is 11 million people. So, people leave there to go back to their homes. But, some people say, hey, instead of going back to our little villages, let's go someplace fun. Like, let's go skiing in the Alps in Italy, or, let's go to Spain, or let's go to New York City, or Paris or London. Let's go someplace fun instead. So 5 million people out of 11 million got out of Wuhan. And that was after first, the Chinese government really screwed up, and this is really their fault. They did this to the world. But a lot of the world have organizations that are better than the CDC, because nobody is as messed up as the United States right now. It's just embarrassing, looking at these numbers for America. So Chinese people can be sneaky. They can, one Chinese woman, who was infected and actually had a fever. She took some drugs to bring her fever down. Then she got by the airport screening, and she got on an airplane and flew to Paris to have dinner with her friends. And then she shot videos and posted them all over social media on WeChat, and then they made it all across the world. So, they can be sneaky. People can be sneaky getting into a country. If they know that there's a ban and they couldn't get on an airplane to go to New York, they might, fly into, Turkey first, and then fly into Canada, and then cross the border. It's so easy to get, from Canada to the United States. Yeah, there's border guards some places, in big cities, but there's lakes. Look at the Great Lakes. Just get on a big boat and go across the lake. Nobody's policing. There's no wall out in the big, inside of a Great Lake. So, you got to have a plan together. You got to, put a bunch of people together and get some kind of task force and prepare for something like this. Adequate policies and procedures to produce or acquire an adequate volume of test kits. These people that smoke drugs and, say, oh, we've got, 1,000 test kits in Atlanta, and we're ready for 27 people, that's for sure. But, the test kits were bad, and there was no plan to get test kits from someone else. How do you fix the test kits? Well, you don't. We just didn't have any. So, you have a country, thousands of people flew into New York. Now, we found out later through DNA, through, taking a stronger look at these viruses, that, there were people from China that came into the country, but most of the people that came into the country that infected and started these early infections, well, the early ones were all Chinese, but New York City, there were more people that were Europeans coming in that infected people coming in from Italy and Spain and the UK. So that's how New York got, in such bad shape. But, if you had adequate policies and procedures, you could prevent stuff like that from happening. You could screen people getting, China has 1.3 billion people, and they contained the pandemic basically in Wuhan province. It's scattered all over the country, but, mildly. Most other cities don't have a big amount of infections. Wuhan is virus-free right now, kind of virus-free. An adequate inventory of personal protection equipment, masks, and Tyvek suits and, booties and everything that comes with the shields, of some kind of a mask and some kind of eye protection and some kind of shield. hand, gloves, everything. You need all this stuff, and hospitals go through all kinds of training for, like, they'll go through a drill during the week for maybe earthquake victims, where there's hundreds of people out there posing like they need medical attention. They've got broken legs and limbs and stuff like that. And they go through these drills where, a hospital can take a couple hundred people and get them in emergency rooms in 20 different hospitals. And, that's a drill to see if the medical system works okay. They have drills for, viruses. And, this is a big drill that happened just a few weeks before this outbreak was Johns Hopkins, and they went through this intense training and invited a lot of the world. China's CDC came over here, and people came in from all over the world to go through this drill and look at all these predictions that would what would happen when we have a big viral attack. But nobody mandated enough personal protection equipment. Nobody actually said hospitals should carry this much inventory, or an inventory of ventilators. SARS, the coronaviruses, attack your respiratory system. So, people are going to need ventilators, to breathe, to make it through, and ventilators are in short supply. We're finding that out now. Why didn't we find it out before? Because the CDC smokes crack all day and they do all kinds of stuff we don't care about. We care about protecting the country from an epidemic. So, or pandemic, I mean. Adequate plan to mobilize people to hotspots. That has to be part of the plan too. And, we finally got the National Guard to New York City, and, they're doing a good job now, but there was no plan for that before we can't even look at other countries and copy what they do. China had a pretty good plan. The model country is South Korea. There's another video that I did on South Korea to show you what, they did everything perfectly. They invented new things to do. So this is where we are now. This is the dashboard. This is Johns Hopkins. This is a research institute, the Center for System Science and Engineering, which is a research institute at Johns Hopkins. I worked at Johns Hopkins, but not at this research institute. And, this is the cockpit that the whole world uses now. The total number of confirmed cases in the United States now, 582,000 people. And that's, a few hours old now, so I don't know what it's up to. But that's how many infections we have. We probably, out of that number, have a couple 100,000 people who are hospitalized, at least, maybe half that number is hospitalized. Enormous cost to our healthcare system. And we have 23,622 deaths so far. And finally, our test number, I think that might be the highest in the world now, 2.9 million tests so far. But that doesn't cover the needs even for New York City. New York, the greater New York metro area. It's funny here. I've worked at Hopkins. I've worked in New York City. I've worked a lot of places. But New York City, the metro area, they don't call it the metro area. New Yorkers call it the tri-state area. So you think they might mean all of New York and all of New Jersey and all of Connecticut, but they just mean, small areas of those three states. And it would be, coastal New Jersey and southwestern Connecticut and, New York, Long Island, and, New York and all of its boroughs, and Brooklyn. So, that area is 19 million people, and right now we have no clue who's infected in New York City. New York City has, tens of thousands of people infected and thousands of deaths in New York City, several thousand deaths. And, there's not enough test kits even now to test everybody in New York City. So this is a complete failure by the CDC. It's just, there had to have been some kind of plan before to make test kits when you have so many laboratories that are capable of doing it, but nobody was given any plan to do it. And that's why we're in this condition right now. We're in this condition because of China, but we're also in this condition because the CDC didn't do their job. Okay, that's all I have. I appreciate your time.